We are Crescent Medical Center located at Kasarani Seasons Stage. If you are in town, number 17B, it will bring you all the way to Seasons Stage. Then the first right turn, you will see Crescent Medical Center. If you are coming from Vika Road, you are right at Roysambu. Pick Matatu from there, number 17B, going to Mwiki. Right at Seasons Stage, which is after Equity Bank. The first right turn, you will see Crescent Medical Center. You are most welcome. The last time, you explained and talked about different services that are offered at Crescent Medical Center.
Yes.
You also talked about family planning. What is family planning?
Family planning is where a couple or an individual plans how many children they are going to get.
Okay.
Yeah, in life.
Okay.
Some may plan to have only one child, others 2 children, others 3, others 4, others 5, depending from one person to another. And so this is a personal initiative. It is a personal decision that one makes. So when you come, you tell the health provider that I want to have maybe 2 children or 3 children. Then from there now you discuss on which family planning do you need to use as a woman to prevent yourself from getting pregnant. Because probably you wanted to get 2 children, 3 children, and so you don't want more children. So when you come, you now discuss which family planning are you going to use so that you can plan your family. But I always advise, if it's possible, it's good to do family planning when you already have some children.
Okay.
Because I find some people coming and they're looking for permanent solution and they don't have a child. So at the end of the day, I ask them, what are you planning for? So I always advise it's good to have at least one or two children. Then you can think of family planning, because there are some of these methods that you may use, or you find yourself struggling now to get another child subsequently, and it might cost you a lot than you thought.
Okay.
So if you are planning a family, my personal suggestion is at least have 1, 2, or 3, then do your family planning. That works well.
Wow.
Yes.
Thank you. And what are the different types of family planning?
Wow, there are quite a number of different types of family planning. I'm going to start with the hormonal. We have the pills. The pills are the ones that are taken on a daily basis. A woman has to take on a daily basis a specific time. If you're taking at 9 p.m., it's 9 p.m. You can't take 9 p.m., 11 p.m., 12 p.m., no.
Why specific time?
So that it can, because it has a duration of staying in your body for only 24 hours and it's out of your system.
Oh.
So if you keep on not having a specific time when you take your family planning method, then you increase your chances of conception.
Okay.
So if you're taking at 8 p.m., it's 8 p.m. If you're taking at 9 p.m., it's 9 p.m. If you take at 7 p.m., it's 7 p.m. Don't keep skipping, because the more you keep on skipping, the more you are increasing your chances of conception. And so family planning, we have the pills. We have the ones that are taken on a daily basis. Some have 1 hormone, others have 2 hormones. Especially mothers who are breastfeeding, they take progesterone pills. In other words, it's only made with only 1 hormone, the progesterone. So they take them on a daily basis, and those ones you don't skip, you keep taking them continually. Then we have also the combined, the ones that have estrogen and progesterone, especially the Femiplan, Microgynon. They are combined pills where we have now the estrogen and progesterone. You also take it on a daily basis, 1 for 21 days. Then you rest for 1 week, 7 days, and that duration is when you're supposed to get your menses. So those ones are taken on a daily basis without omission. And if you omit, then it means if you never took a pill, it might give you a chance of conception. So we tell you, kindly make sure that you take them faithfully without omission. Then we have also the Depo-Provera. Depo-Provera is this injection that we give the mothers. One is given monthly, another one is given after every 3 months, and that one is made with only 1 hormone called progesterone. So we give you the jab, and then it stays for 3 months. Then after 3 months, 90 days, you come again for another I think it's 84 days. It's actually 84 days. After 84 days, you come for another injection to prevent you from getting pregnant.
Yes.
We also have the no plant. No plant is also a progesterone. It's also made of only one hormone. It's actually put at the hand. We have one that we put on the hand called Implanon, which takes a woman 3 years. It can stay in your body for 3 years, and it prevents you from getting pregnant. We also have another implant called Jedel that is put in the hand, and it gives you protection pregnancy for 5 years. But it's good to note that there is no family planning which is 100%.
Oh.
Yes, you can conceive when you are even when you are very faithful, you can conceive when you are taking the pills. You can conceive when you are getting the injection. You can also conceive when you are getting the no plant or implants. So that's another method. We also have another one which we call IUD. IUD is intrauterine device. It is non-hormonal. We have a non-hormonal and we have hormonal. The one which is hormonal is called Mirena. The one which is not hormonal is called Copper T. And that now, the Mirena one takes you, the one which is hormonal gives you a protection of 5 years. The one which is non-hormonal, which we call Copper T, gives you a protection for 12 years. So it depends with what the woman wants. You give the information, then now the client makes an informed choice on which family planning they are going to use. We also have condoms. There are couples that feel comfortable to use condoms because they don't want to use any hormonal or non-hormonal family planning. And it's important for us to say that all these family planning methods, they don't prevent you from HIV infection. So what we recommend a couple to use is the condom. If you are able to use a condom, well and good, for you to prevent from getting pregnant. There are also some that are also spermicides. They are like tablets that are put before one has sex, like 5 minutes before you have sex or 10 minutes, you put it inside the vagina so that when the man ejaculates, then that tablet can be able to kill all the sperms so that the woman does not get pregnant. We also have condoms for women.
Okay.
Condoms
for
women is not just only for men. Yeah, the woman inserts before sex, and there is a way it is inserted and there is a way it is removed. So all these things we explain to the mother, we tell them what are the advantages, what are the disadvantages, when do you put it and when do you remove it. So the health provider, whether a doctor, a nurse, a clinical officer, can be able to explain to you all how you're supposed to use all those family planning methods. So what you're supposed to do is to give the patient the information, then from there they make a choice and then you guide them, depending with what you have chosen. But every family planning method has side effects, especially the ones that are hormonal, and there are pros and cons. It has the advantages, it has the disadvantages. Yeah, so you weigh the advantages and the disadvantages, then you make a choice. Yes.
Do you have family planning for men?
Yes, we have the vasectomy, where now the man is cut, tubes that take the sperm, and by so doing, then you have to use maybe condoms for about 3 months after the vasectomy is done, because it is still believed that there are some semen that may be in the storage. And so they use the condoms for 3 months. Then after that, the man goes for examination to be seen whether there is any sperm. If there isn't, then they continue the normal sex between a husband and a wife. So vasectomy is there, but not many men agree because of the myths. There are a lot of myths about it, that it will make you impotent, it will cause you to have pains, all these things. But when you talk to the health provider, they are able to give you the advantages, the disadvantages, the myths, demystify them, and from there you're able to make an informed choice for the man, so that the man can actually choose whether he's going to go for vasectomy or not.
All right.
But it's voluntary.
Yes. Wow, thank you. Today you have really educated us on family planning. And we trust that our viewers have been able to get all this information so that you get to know what we do at the Grace City Medical Center. Again, I want to remind you we are located at Seasons Stage, that is Kasarani. From town, you get the number 17B, right at the Seasons Stage. If you're on Thika Road, again, right at Roysambu, and then you take matatu going to Mweki. Tell them that you're going Seasons Stage. It's like 2 minutes from Thika Road, very short distance. Seasons Stage, you will see Grace City Medical Center, the first right turn. And if anyone would want to reach you,
wow, yes, you can give us a call on 0712 265 746. 0712 265 746. That's our number, and when you call, you're gonna get me, and from there I'm able to book you depending with what you want, and from there we are able to begin your family planning method and walk the journey together. And in case of any challenge, then we are able to see what do we do.
and someone may be asking,
Yeah,
when are you opened?
we are opened daily from Monday to Saturday, from morning till late evening. You will find us here. Only give us a call, and then from there we are able to organize. When you are available, we will also be available for you. Any day you can get our services.
And even I think on Sunday afternoon, if one has an appointment, they can be able to talk to you after church,
Yes.
and you're able to give them.
Oh yes,
your
that's
services.
very true. That's very true. Just call that number or text that number, and then at the end of the day we are able to communicate and see the way forward.
All right.
Yes, it's doable. Any day we are opened.
Until next time, I've been your host, Joseph Monende from Grace City Medical Center. Thank you for giving us your time. God bless you. Until next time, from us we are saying bye-bye.